The Department of Health and Human Services has updated its vaccine recommendations for children. Joining us now to talk about that and more, our Med Team doctor and infectious disease expert, Dr. Ed Dominguez. Dr. Ed, today's announcement comes in the middle of cold and flu season. Which specific vaccine schedules have been adjusted, and what does this change mean?
Like we started as we heard a couple of weeks ago, no further routine vaccinations for hepatitis B virus or for RSV, respiratory syncytial virus. At 2 months, the children were getting rotavirus vaccines. Those aren't routinely recommended. That's a type of diarrhea that can be very significant. At 12 months, the hepatitis A vaccines are no longer routinely recommended. At 11 years, only one HPV papillomavirus vaccine is recommended for our young children, but not two, and no further meningococcal routine vaccinations for a type of meningitis. And finally, all flu and COVID vaccines routinely should not be given to children unless they have risk.
And Dr. Ed, as mentioned, these are recommendations. So if you're a parent out there of a child, you still get to make the choice. What should parents take away from the new recommendations?
You do get that choice. I'm glad you said that, Blake. You have to confer with your healthcare practitioner. These vaccines are all still going to be available. And for children who warrant them, I should say, then it is appropriate to give them. And the state can mandate it, though our state won't routinely. I do want people to understand, however, Blake, that there are no new studies or data that led to these conclusions and these changes. What the administration did is they went back and looked at the old data, both good and bad studies, to come to these conclusions. There's still going to be a lot of controversy about which vaccines we should give and how, but talk to your physician. You guys should make the decision.
Dr. Ed, something else here. Today, Health Secretary Robert F. Kennedy Jr. released some new dietary guidelines urging Americans to avoid processed foods and added sugar. These guidelines can affect many things, including what is actually served to students in school and what doctors recommend to their patients. What are some of the most significant changes that could result from this?
Well, the first significant change has to do more with adults, and that's the issue of alcohol. The government used to say 1 to 2 drinks a day at the most. They've taken away that cap. They still say limit alcohol, but they don't tell us by how much. So that cap is taken, and that's a concern. On the good side, the administration is saying no further processed food should be consumed, at least in high quantities. They've inverted the food pyramid so that we're eating a lot more fruit, fresh vegetables, grains, natural grains, and more protein. The issue is going to be, how does this affect school lunches? Well, it takes about 4 years for these recommendations to make it into the school lunch.
All right, Med Team Dr. Ed Dominguez, as always, our thanks to you.